Welcome to my YouTube channel. Our today's topic for discussion is electrocardiogram waveforms. In today's topic, we will learn definition, representation, duration, and morphology of all waveforms. Understanding electrocardiographs can be tricky, but I've got a simple trick that might help. Think of an electrocardiograph as a visual representation of your heart's electrical activity. The spikes and dips on the graph correspond to different stages of your heart's rhythm, one way to understand it better is to imagine a roller coaster ride. Just like the ups and downs of a roller coaster, the peaks and valleys on the electrocardiograph show the different phases of your heart's electrical cycle. It's a fun way to visualize it. Give it a try and let me know if it helps. I can tell you a bit about the history of the electrocardiograph. The electrocardiograph, also known as an ECG or EKG, has a fascinating history. It was first developed in the early 20th century by Willem Einthoven, a Dutch physiologist. Einthoven's invention revolutionized the field of cardiology by allowing doctors to record and analyze the electrical activity of the heart. Over the years, advancements in technology have made ECG machines more portable, accurate, and accessible. Today, the electrocardiograph is a vital tool in diagnosing and monitoring heart conditions. It's amazing how far we've come in understanding and caring for our hearts. Now let's come to our today's discussion. 1. P-wave. Definition of P-wave: first positive deflection, usually followed by QRS wave. Representation of P-wave. It represents atrial depolarization, also known as contraction. Duration of P-wave: normal duration, less than 120 milliseconds or 3 small squares. Amplitude of P-wave is less than 2.5 millimeters. Morphology: absent in atrial fibrillation, usually positive biphasic in V1. 2. QRS wave. Definition. Q-wave: first negative deflection after P-wave. R wave: first positive deflection after Q-wave. S wave: first negative deflection that extends below baseline following R wave. Representation: it represents depolarization of ventricles, also known as contraction. Duration of QRS wave: normal duration is less than 120 milliseconds. Morphology: R wave: progress from small to tall V1 to V6. 3. T-wave. Morphology of T-wave. 1. Upright in all leads except in AVR and lead I. 2. Normal height is less than 5 millimeters in limb leads 2. 3. AVR, AVL, and AVF. 3. Normal height is least than 10 millimeters in precordial leads V1 to 6. V1 stands for right sternal edge and fourth intercostal space. Representation of T-wave: it represents repolarization of ventricles, also known as relaxation. 4. PR interval. Definition: start of P to start of QRS. Representation: conduction through the atrioventricular node. Duration: normal duration is 120 milliseconds to 200 milliseconds. 5. Saint segment. Definition: it occurs at end of QRS to start of T-wave. End of QRS wave is also known as J-point. It represents interval between ventricle depolarization and repolarization. 5. QT interval. Definition: it appears in start of Q wave to end of T wave. Representation: approximates time when the ventricles start to contract to when they finish relaxing.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.